Okay, again, returning from essential supplies, so I'm going to 220 or sanitize. Okay, so what supplies do I need to get, and what gloves should I be getting into? Good, patient treatments and overs. I'm going to need gauze and a sleeve and an extra pair of overs. Good. So did everyone hear what Marwa said? I need patient treatments and overs. I need an extra pair of overs, a syringe cover, and a 4x4 gauze. What's the last thing that I'm going to likely be getting? The last, in what sequence? What's the last thing I should take out? It's a trick question. Typically the gauze, because if the gauze is in my bottom drawer, is it contaminated? So if I was getting out sterile gauze, it wouldn't matter, but if I'm using the one left over, I want to take out my clean supplies out of here and take that gauze out last. Okay, so picture now we've used that handpiece, it won't have that sleeve on it anymore. Do you think it's likely if you polished the patient that there's a lot of saliva and blood potentially on it, right? It's probably blood-soaked, saliva-soaked at this point. So where would I be placing it? Biohazard. So right now I have on my patient treatments and overs. I'm going to slide this kind of up over it so everything is contained in there, and then I'm going to pull it straight off the handpiece. So I want to just pull it straight away without bending when I pull, because then you can crack that piston in there and it's impossible to get out without sending it back to the manufacturer. So you just pull straight. And that will come out. I'll leave that there, and then so this propy angle and the cover that was on it goes into the biohazard.
So with the sleeve and then...
Yeah, you kind of bring it over it so that it's covered. It's a little barrier. It keeps everything nice and neat. Throw them out together in there. Then these overs, I just touched the contaminated handpiece, so they're not going to serve to prevent cross-contamination anymore. So they're going to come off, go into the regular waste. And then I'm going to detach my handpiece. Put that there for a second. And so now I need to get on one over glove. And you're going to put your over glove on your dominant hand. So those of you that are right-handed, it goes on your right hand. Left-handed, goes on your left hand. I'm going to take my oil, and I need to place 3 drops of oil into the small drive air tube, which is the small gold tube on here. So the small drive air tube, which is the smaller one, it's the gold one that's in there. Now can I stick this into that small drive air tube? Can I stick this in there? No, why? So I'll contaminate it, and we can't do that. So I usually joke, depends how much caffeine I have or haven't had, how long it takes me to get the drops in there. So usually when I start squeezing, then it starts to shake. So you want to get your 3 little drops, 1, 2, 3, in that hole without touching it. So sometimes it's fast, sometimes it takes a second to get there.
What color is it again? Sorry.
Small dried air tube is what it's called.
Small dried air tube?
Mm-hmm. And it is listed, it is written in the manual.
Okay.
So you'll see that in there. So I put that in there. I'm just going to get my over off. And reattach that to the hose. Get into my overs, and I'm going to cover the handpiece with the other sleeve that I have. And then I'm going to run this for 30 seconds. So that's going to work the lubricant through the handpiece. So when that's done, this comes off. And the reason why we put the bag over it, and if you look in here, it just catches the oil so that it doesn't go everywhere. So you can see like there's some cruddy looking oil. So that comes off, goes in regular trash. I'm going to keep my patient treatments on. I'm going to take the gauze square that I have, dampen it with a little water. And just wipe the handpiece down with that. The handpiece can't be submerged, so it can't go into the ultrasonic bath or anything. So the way that we would get any debris off is just thoroughly wiping it with a dampened gauze, which is also partly why we had it covered with that syringe, so that you keep it generally clean, so that there shouldn't be much debris on there. So I'm going to wipe that down, discard my gauze. Same gloves that I had on, I'm putting it into the pouch. And sealing that up. Can I leave my treatment environment with contaminated gloves ever? No. So I'm just going to remove these, sanitize, and get into clean patient treatments and overs, and bring it back to Central Supply.
You still put it on top of it.
It still goes on top of that. Just know that if you are responsible for loading, that it would go, as you're taking stuff off, you put that into the Tuttenauer.
Why are you ordering patient treatment?
Because I just handled this and I had to touch the pouch and everything, so it's not necessarily clean, and so the patient treatments are going to give me a barrier to return this back there. It's just protection. Right, because I had to touch this pouch, I had wiped this down, so this isn't necessarily a clean pouch. So now my hands are protected. All right, so let's bring this back and show you where this goes and then explain what we do with the oil that. When I load it into the Tuttenauer, how should it go? Paper side up, plastic side up? Paper side up, excellent. Why?
So the steam take out.
Right, because if you put it plastic side, moisture will get inside, but then it doesn't have a way to get out. It's trapped in the plastic, and then your bag is more likely to rip and tear, and you don't have a good integrity for keeping it sterile. So it should go paper side up when you load it. The oil is going to go right on the side of the Tuttenauer over here. And so if you're ever the clinic manager and you see that there's bottles or supplies that are left there, it means that they need to be disinfected. And items that are here are typically disinfected like a patient treatment supply, meaning you would have on patient treatments and overs, and an extra pair of overs. You wipe it once, change your overs, wipe it a second time, and then it's ready to go back in the cabinet. So a lot of times there might be 5 or 6 bottles of oil. I would do my first wipe of all of them, do my second wipe of all of them, and then they can go back in the cabinet. So if you see them here, that's what it means. They need to be disinfected.